Hi, this is LeJune with LeJune Singleton LLC, Fitness, Health, Nutrition, and Wellness Podcast. Today, I'm talking with dental hygienist Gennifer Afari. Thank you for joining me today. How are you?
I'm good. Thank you for having me. I'm excited to be here.
I am excited to have you to educate the public about dental health.
Yes.
So, can you give a background on who you are?
My name is Gennifer. I've been in dentistry for about 6 years now. I received my bachelor's in psychology from Bowie State University. I then went to Howard University College of Dentistry's dental hygiene program. And then I have been a dental hygienist since 2018. I'm originally from Columbia, Pennsylvania, and I currently reside and practice in Washington, D.C.
Okay. And what was your motivation to get into the dental industry?
I've always felt empowered by my family and healthcare professionals when I was in their care to be in this profession. Growing up, I always knew going to the doctor or the dentist, I always knew that this is where I wanted to be. I enjoyed every visit that I went on. And I just knew that this is something that I would want to make a career out of. But growing up, a lot of the healthcare professionals didn't look like me. And I think back now what a world of a difference that would have made if I would have had healthcare professionals taking care of me that looked like me.
And speaking on that, do you think that is one of the issues within minority communities such as ours, why people don't go to the dentist?
Yes, I do think that is a reason because that compatibility that you have, that patient rapport that you can build can sometimes also cause like a disconnect. And so a lot of people can be very reluctant to receiving services that they need for their health.
Okay. And how often should an individual be seen by the dentist or someone like yourself, a dental hygienist?
Yes, so patients should go to the dentist every 6 months. You want to go for your recare appointment every 6 months to receive a dental cleaning. If you go and they tell you have other issues, you may have periodontal issues, then you would be put on a periodontal maintenance schedule, which means that you need to be seen every 3 to 4 months. And then another reason why you want to go is if you have any dental pain or a dental emergency, you want to go immediately to your dental healthcare provider, but every 6 months for your regular checkup.
And what about people who have braces or permanent retainers?
Same thing. You want to go every 6 months unless otherwise noted.
Okay. And speaking of gum disease, what are some of the causes of gum disease and what should people check for when it comes to gum disease and oral cancer?
So if you have gum disease or you have periodontal disease, you are going to create a plan with your dental hygienist. And once you create a plan, once they go over your perio charting, your x-rays and everything, you would then be on a certain type of recare.
And how is oral cancer found in people?
So that's a big thing that dental hygienists detect. When you come into the dentist, we do a head and neck examination. So we check your lymph nodes, we check your tongue, your tonsil area, your throat. So we can almost always catch cancers in the mouth, oral cancer, throat cancer. We're checking for those things. So every time you're coming in for a cleaning, we are checking for those things because those things can go undetected.
Okay. And speaking of the tongue, why should people brush their tongue?
People, please brush your tongue. Brushing your tongue is very important because that's the main area where bacteria lives. You want to brush your tongue because it's going to produce bad breath if you do not brush your tongue. You don't want, your tongue should be pink. You don't want any film, like any white, any discoloration on your tongue at all. You want to use your brush, or if you have a tongue scraper, you can also use a tongue scraper as well.
Okay. And how often should people be brushing their teeth as well as their tongue? And what is the proper way for someone to brush their teeth?
So you want to brush your teeth at least 2 times a day. So in the morning and at night. And the proper way to brush your teeth is to use circular motions for up to 2 minutes. You want to start from the back and work your way up to the front. You want to get all surfaces of your teeth as you're brushing. And you want to make sure that you're putting your tooth bristles to your teeth for at least 2 minutes.
And after someone brushes their teeth, should they rinse their mouth out with water or no?
So my recommended method that I tell my patients is to brush your teeth and then floss. And then after you floss, you want to rinse. Whether that is rinsing with water is fine, but I recommend using a mouth rinse that has bacteria fighting agents in it. So like Listerine or Act would be recommended after you brush, floss your teeth.
And speaking of mouthwash, what do you recommend the best mouthwash in regards to mouthwash with or without alcohol?
So my recommendation is Listerine. However, you do not ever want to use alcohol. And the reason why I say that is because alcohol can cause your mouth to dry out. And also alcohol fights the good bacteria that's in your mouth, because you have bad bacteria and good bacteria, and the alcohol will get rid of the good bacteria, which will make your mouth more acidic, which can lead to dental caries and gingivitis and tartar and things like that.
Wow. And what is the proper way to use a water pick?
When you're using a water pick, you want to take your water pick, fill it with water. You want to start from the back, work your way up to the front. You want to lean over your sink as you're using your water pick and start at the cervical line. So the cervical line is where your gums and your teeth meet. You want to go around the whole entire tooth. So each tooth, you want to go around the line of it, getting in between each tooth and going around, doing the same thing until you've touched every single tooth. And then as you're doing that, you want to kind of just let the water fall out of your mouth into the sink. But I always recommend using floss. I think floss gets the bacteria better than a water pick, but if you choose to use a water pick, that's the method that you would use.
And speaking of floss, I know now the big thing is floss sticks, which, sometimes it doesn't get everything out. What would you recommend and what type of floss? Because I know it's the glide floss and the regular old school floss. Which is the best recommendation?
I recommend regular old floss, and that's just because, like I said, when you want to use a C-shaped method when you're flossing, you want to take your index finger and your thumb and hold the floss tightly in between both, and then go up and down into the contact areas to get all the bacteria and everything out. With floss picks or threaders, you can't do that, so it's kind of hard. I recommend the floss picks for my elderly patients just because they have like dexterity issues. But regular floss would be my recommendation over floss picks. But if you prefer those, then use it. My main goal is to just make sure that my patients are flossing.
And what is some things that we do that's damaging to our enamel?
Acidic food. That is probably the most damaging thing that we do, is ingesting anything that's acidic, or anything that can become acidic in the mouth, because that just wears away at our enamel. And the enamel is the first defense to fight against cavities. And when we're creating an acidic environment in our mouth, it makes enamel's job so much harder to fight against those cavities. And so that's probably the biggest thing.
And I've noticed a couple of my friends have had this issue where their tooth just like breaks or chip or
Yeah.
something. What
Yeah.
is some of the causes of that?
Yeah, it's what you're eating, it's what you're
Mhm.
ingesting. Whether you're eating something too hard, or the foods that you're eating, if it's like really tacky, or gummy food, that can sit on your teeth and then create an acidic environment, that's going to cause your tooth to break off. That's going to cause decay there. And as when you get older with age, your teeth and your enamel are going to become more brittle, and that's just natural. But what you're eating is a big part of your oral health.
And speaking of toothbrushes, what is the best type of toothbrush to use? Because I know they have like soft, they have the hard bristles. What's the best toothbrush to use?
Yeah, the best toothbrush would always be a soft toothbrush, and that's just because majority of patients brush too hard. They think that if they brush harder or faster, they'll get all the plaque and bacteria, but that's not the case. You want to always use a soft toothbrush because you don't want to cause abrasion to your gums.
And how does oral health affect physical health?
Everything in your body is connected. When you are not brushing and flossing and taking care of your oral cavity, that's going to cause your health to decline, because all the bacteria is sitting in your mouth, and it's going to travel. It's going to penetrate the gums and travel through your immune system, which is going to can lead to traveling to your heart, causing a stroke or a heart attack. And these are all things that you can prevent with just brushing twice a day and flossing once a day.
Okay. And what type of toothpaste would you suggest? Because I know it's fluoride and it's, sodium and many others. What's the
Mhm.
best toothpaste to use?
I always give my samples or tell my patients to use Crest, either Pro Health or Gum Detoxify. Those are my two faves right now. And that's just because those two have those two have stannous fluoride in it. And you
Mhm.
always want to use a toothpaste with stannous fluoride in it, because that's going to fight against cavities, gingivitis, plaque, and tartar. With other toothpaste, it's just going to have cavity fighting agents in it, but you kind of want everything all in one.
Which is great because I love Crest, so I actually
Yeah.
use that. Thank you.
Yeah.
Um,
And whitening as well. There a lot of Crest products have whitening agents in it, that hydrogen peroxide you need to whiten your teeth.
it's the whitening. How much is too much whitening? Because I know now that's the new craze. They have the trays that you can buy over the counter. They have the
Mhm.
toothpaste. They have
Yeah.
everything now
Yeah,
that
they
you can do
do.
it.
Yeah, they do. In my experience, what I've seen works is going into the office and having in-office whitening. When you go into the office and you have your whitening done there, they then can give you bleaching trays that you can take with you and then kind of do touch-ups every month or every other month if needed. Most of my patients that I do whitening on, after about 3 or 4 months, they just do their at-home touch-ups, or can even go longer than that, because they feel as though the in-office whitening got them to the level where they wanted to be at.
Okay. And can you explain the difference from a dentist and a dental hygienist? Because I'm sure you get people that come in and think you are the dentist and the hygienist. So can you
Yeah.
explain the difference and what your actual role is as a hygienist?
Yeah. So the dental hygienist co-diagnoses. Once they co-diagnose with the doctor, they perform a prophylaxis, which is a dental cleaning, or they tell you that you need other services, which would be scaling and root planning. We call that SRP. And then another main thing a dental hygienist does is patient education. We are so big on informing our patients, making sure that they understand the severity of maintaining their oral health. And the dentist, their main goal is to diagnose and treat disease. Once they do that, they come up with a treatment plan for you to take care of whatever disease is going on in your mouth. Whether that is you need a root canal, a crown, things like that, that's what the dentist does. So that's the main difference between the two. And a lot of people, especially my friends, they always just assume like, oh, you're a dentist. It's like, no, I have to correct them. Like, I'm a dental hygienist and this is what I do. So, yeah.
So what are the risks for patients that are not even patients, for individuals that don't come in or to the dentist at all? What are the hygiene risks?
The hygiene risk. So your oral hygiene will decline if you're, especially if you're not maintaining a good dental hygiene regimen at home. Diseases that are linked to having bad oral hygiene is lung disease, heart disease, diabetes, cancer, and gum disease. So those are the things that patients are, facing if they're not coming for their regular dental cleanings.
I know before the whole COVID-19, that was one of my things. The first thing I look at is somebody's teeth. I don't know why I do it,
Yeah,
but I'm
yeah,
sure. And, you see most people, they have all this plaque, and it's like, oh, you don't go to the dentist. So,
yeah. It's yeah.
so I'm sure that, you've seen it all. And how do you handle, when patients come in? How do you, keep your composure? Because I know you've seen it all. How do you keep your composure when people come in and you can tell they haven't been to the dentist in years or not at all?
Yeah. So my first thing is I just want to build a rapport with my patient. If they've experienced any dental trauma in the past, I want to make sure that they won't experience that again. And my biggest thing is patient comfort. I feel as though when you come into the dentist, it shouldn't hurt. It shouldn't be a painful experience for you. So that's really what I focus on. And then I let them know the severity of whatever is going on, but I give them the necessary steps and tools needed to get them into a recovery process for their oral health. So patients that don't come into the dentist office or have never been to the dentist, I just try my best to get them as healthy as I can, and then kind of tell them like, these are the steps that you need to take, or else, X, Y, and Z could happen.
And at what age should a patient come in and start service? What's the youngest? And I know when most people get older, they get over a certain age, they feel like I don't need to come to the dentist anymore.
Yeah. So when infants get to about 2, 3 years old, you want to start taking them to see their dentist, just to make sure that everything is coming in fine, that nothing abnormal is going on in their mouth, and see how mom and dad are helping this child keep up with their cleaning of their mouth and what's the routine and things like that. So about 2 to 3 years old is the first time you want to start bringing children in to see the dentist or the dental hygienist, just to make sure that everything is okay and nothing is wrong.
Okay. And how do you see wellness and oral health tying in together?
So Wellness and oral health definitely go hand in hand. When you when you look good, you feel good. And I just feel as though keeping up a healthy lifestyle, maintaining a healthy lifestyle is essential for your oral health, and vice versa. And it's so easy to let either one of those things slip away from you. But you always have to maintain a routine and always get yearly checkups, going to see your doctor, getting yearly physicals, and just making sure your overall health is where it needs to be.
Okay. And you kind of touched on my next question of how mental health also affects oral health.
Yeah, mental health is a big thing when it comes to oral health, and that's just because when somebody is suffering or dealing with mental health issues, it'll affect their oral health. And I say that because patients that are suffering from like anxiety or some form of depression usually let their oral health slip. If you're suffering from depression, you can't even get out of bed. You don't want to shower. You don't want to brush your teeth. You don't want to do any of those things. So then you would see a decline in that patient's oral health. And it just affects your overall emotion and reaction to things. So when a patient has a chipped tooth or a lot of tartar or calculus or buildup on their teeth, they don't want to smile or they don't want to open their mouth, and it can make them timid. It can affect them getting a job, seeing friends, wanting to be social. So those things definitely go hand in hand.
And how do you balance career, family, and your personal time?
That is a really good question. I I try to balance it as best as I can. I still haven't found a routine or anything that works for me. But I, try to maintain a healthy lifestyle by exercising, seeing family and friends when I can. I know due to COVID, that makes it nearly impossible. But yeah, I try my best to stay well grounded and not put too many things on my plate at one time.
And speaking of COVID-19, has that limited the services provided at your dental office?
So for COVID, it hasn't limited any services that we provide. It's just new protocol or new way of doing procedures, but it hasn't limited anything. We still do everything in office. It's just an extra added layer of protection that we need to keep for ourselves and for our patients, with, call it, COVID protocol, but it hasn't limited services that we provide. We still provide everything in office.
And what ventures do you have coming up next?
So I'm glad you asked. I actually am working on my business right now as the prevention specialist. My business is going to be Road to RDH. And what that is just going to offer services for in-home board tutoring via Zoom and like board course review materials, CE courses, which are continuing education courses for registered dental hygienists to take. Dentists can take them as well. Dental assistants can take them. And then people that are in college as well can take them for when they do graduate. And my business is just going to focus on getting started. As I was younger, growing up, coming up, trying to get into the dental field, the dental world, I didn't really know what path to take. And I wish I had somebody like me to tell myself, like, hey, you should do this, or hey, you really don't need that. And I'm trying to focus on getting people started into this profession, into this career, because it's such a good career path. It's so rewarding. And I just want to provide services to let people know, like, hey, this is what you need to get to from A to B.
And I think that's amazing. Are you visiting like high schools or communities for, you know, young minorities to know and see somebody that looks like them in a dental industry?
Yes, definitely going to high schools, definitely going to career fairs, definitely, reaching out to colleges and professors, and letting a lot of students know that these are the options that they can take to go down this road.
And do you think that because we don't see enough of ourselves in the dentist industry is one of the reasons why most minorities don't get into the industry?
Yes, I do feel like that definitely plays a part. And the field that I'm in is already competitive. So when you don't see somebody that looks like you, where do you find that motivation to say, hey, I can do this too? Definitely seeing more Black and brown faces will tremendously help younger children, kids growing up to get into this profession as well.
And is your business only in DC or do you offer services in Maryland and Virginia as well?
So for right now, it will be Maryland, Virginia, and DC.
Okay.
For the in-home, like online tutoring, that would be, in the US, of course. But for right now, it's just DC, Maryland, and Virginia based.
Okay. And I think that is very amazing because that's one thing I look for when I look for my dentist. I wanted a Black female.
Mm-hmm.
That's definitely important because I want somebody that looks like me, that
Yeah.
understands, as a Black woman, health risks and things like that. So I think that's amazing. And I would definitely like to have you back when it's definitely up and running and COVID is over and you can go visit the schools and
Yeah.
kind of give feedback on that. So thank you for joining. And how could someone reach you that's interested in that program?
So I will have my website information for you to give to everybody to reach me for those services.
Okay, that's great because I know, I have friends who have kids that are graduating high school, and hey, that may be an avenue that they're definitely interested in.
Yeah. Yeah.
So thank you so
Thank you
much
for
for
having
joining
me.
me.
Yes.
And I would definitely like to have you back really soon. Thank you.
Thank you.